stop serving tables at 6 o'clock each day. France tonight announced a new lockdown starting Friday, but Italy is trying everything to avoid that. Still, people are already at the boil, from Milan to Turin, where protesters trashed a Gucci store, to Rome, where police resorted to water cannons. There is anger fueled by fear of falling into poverty.
We can't have Class A citizens and Class B citizens. We all have the right to bring food to the table for our children. While in this way, it's not happening.
In Germany, which just announced a lockdown light, closing restaurants and some entertainment venues for a month, demonstrations took on a carnival atmosphere, but the message was dire.
How does it feel to be banned from working virtually overnight since March, and not a cent has fallen into your wallet since then? Warm words are of little help here.
Around Europe, they worry about not having the staff or beds to handle this second wave. In France, military and commercial planes have been deployed to move patients from overtaxed regions to those that have beds. In Belgium, reports of some asymptomatic medical staff with COVID being asked to keep working. And in Russia, a nationwide mask mandate went into effect today as the government took its most drastic action yet to curb the spread of the virus. Italy had drawn praise for being one of the most coronavirus restriction-abiding countries. The Pope, the only high-profile person who often skips the mask for fear it keeps him too distant from his flock. But now it's proving not so easy to convince people here and across the continent that staying shut and staying home is best. And the European Commission President Ursula von der Leyen said, this time around, we have two enemies, the coronavirus itself and corona fatigue, increasing weariness to take precautionary measures. In Milan, Italy, Amy Kellogg, Fox News.
Back here in the U.S., we're averaging nearly 70,000 new COVID-19 cases per day nationwide, and the average daily death toll now stands at 800. Fall surge is beginning to put a strain on hospitals in hotspot areas like Wisconsin and Texas, and it's forcing officials to rethink their reopening plans. In New York City, small businesses will be allowed to expand their storefronts to the sidewalk in hopes of generating more customers and reducing indoor traffic. But even this is being met with caution.
We do have an immediate danger of a second wave in New York City. We fought it back so far effectively. And so we're going to be very careful to make sure there is no continued danger of a second wave.
The case surge sent stocks tumbling today to their lowest point since the pandemic started back in March.
The president has made it clear he wants a COVID-19 vaccine available before the election. I checked in with a local doctor in charge of overseeing part of Pfizer's worldwide vaccine trial.
Nearly impossible. That's how Pfizer's CEO described the likelihood of a coronavirus vaccine before the November 3rd election.
I think that's a pretty good prediction.
42,000 people worldwide volunteered for Pfizer's vaccine trial. You receive a vaccine or a placebo shot. Dr. David Fitzpatrick is overseeing over 550 Hawaii volunteers.
You have to do the science. We have to be super careful. We don't want to put out a vaccine that is not effective or is not safe.
But
everything is looking really good with this vaccine. It looks like it's going to be very safe.
Local residents Dr. Albert Lin, businessman Joe Ho, and retired HPD detective Gary Lahans are taking part in the trial. Of the three, Lahans experienced severe side effects that lasted for 10 hours.
Just shaking all over. You know, my teeth, you know, my hands. I was getting a little bit worried. It was a moment of anxiety, you know, because I saw I had a fever and I kept shaking. Yeah, so I had 3 comforters. It still wasn't working.
You know, that's a sign that your body's reacting to the vaccine.
Is that a good thing or a bad thing?
Well, it depends on your perspective. It's a good, now I don't know who gets the vaccine, and people in the study don't know. But if you have a reaction to it, you might jump to the conclusion that you got the vaccine.
These three say it's worth it.
I'm doing my part to protect my family and the public. You know, I'm risking my life to do that. That's how I feel.
This is one of the major moments for our lifetime in humanity where we need to trust this process, because it's more than just us.
I just hope this thing works because I need to get out of here and start traveling like I used to.
Before the trial ends, Dr. Fitzpatrick says 100 more local volunteers are needed.
We're aiming for a total of 44,000 people worldwide. The goal is to show that the vaccine works. And once we've got 44,000 people immunized, it is a matter of waiting until there are 32 infections, and then the Data Monitoring Safety Board, which is an independent board not connected to Pfizer or anybody else, will then look at the data and determine whether the vaccine is effective. It would have to be 77% effective to be confident that it worked.
If you'd like to be one of the 100 volunteers, sign up on eastwestresearch.com. You must be between 18 and 55 years old, and they're interested in high-risk people, those with underlying health conditions, first responders, healthcare workers, or essential workers, such as grocery store employees. I'll post the details on KHON2.com.